The virus isn't done with us yet.
As Manitoba inches closer to slashing both the vaccine and mask mandate, the question is, what is the plan moving forward to tackle COVID-19? Where do we go from here? Restaurants, indoor and outdoor sporting events, and gyms all now at normal capacity after the province implemented new public health orders last Tuesday. But it's the removal of proof of vaccination and mask requirements that has some in the healthcare sector scratching their heads.
What happens when you start to introduce people back into an area where the virus is still transmitting? And I don't think we know. I think we're going to find out very quickly.
University of Manitoba virologist Dr. Jason Kindrachuk says it's still important to remain cautious, even with the removal of public health orders. He says the province needs to be transparent with the public and provide a threshold and a plan on what it'll do if COVID resurges.
If you throw restrictions at people without having any prior discussion that these could be coming or that we are reaching or getting close to these thresholds, I think it's going to be hard and difficult for people to go back to that.
On Thursday, Doctors Manitoba provided an update on the increasing diagnostic and surgery backlog in the province. They estimate the backlog now sits at over 161,000 cases, with over 52,000 Manitobans waiting for surgery, 42,500 waiting for diagnostic imaging procedures, and well over 66,000 individuals waiting for other procedures such as mammograms. Doctors Manitoba President Dr. Christian Thompson says hospitals are continuously overflowing and remain in a critical state due to COVID cases.
COVID-19, it doesn't care about borders. It doesn't care about what government officials say. It doesn't care, about health policies. It is a virus that is infecting and evolving.
More than 2,500 COVID-19 patients have been admitted into hospitals over the Omicron wave in Manitoba, which amounts to around 40 patients per day.
Our hospitals, they're still overwhelmed. And so while we're seeing restrictions easing right now, as I said before in my messaging, we still need to be COVID cautious.
Dr. Kindrachuk is urging Manitobans to continue following safety measures and precautions, saying we're not out of the woods yet.
In learning to live with the virus, we have to learn about the virus. We are still in that learning stage. So assuming that we know everything about how this virus is going to behave and how it's going to react and change over the coming months and years, we have no idea at this point.
In Winnipeg, Alex Karpa, City News.